At Intermountain Healthcare Mental Health Integration, MHI is an approach to healthcare that focuses on both. Dr. Travis Mickelson joins us today to talk about exactly what MHI is, and we can't stress enough either of how important mental health is impacting your regular health, your overall physical health, right?
Right. We can't overemphasize that our physical health, our mental health, our social health are all part of that whole health. It's all very important.
There was a study out by JAMA. It was a pretty vigorous, intensive 10-year study. Talk about what they found or what they did with that.
So that was a great study that allowed our program. So what we did is we followed patients for about 10 years, and a percentage of these patients were seen in their regular primary care clinics, and then a percentage were seen in a primary care clinic that had some expanded team-based mental health integration resources. And at the end of that study, those patients who had access to a program like mental health integration had better health outcomes, fewer hospital visits and emergency room visits, and decreased medical costs.
All very important. And so here at Intermountain Healthcare, you've adopted those integrated teams with personal care, physical care.
Right. So these days, if any patient in this state who has a primary care provider that's an Intermountain Clinic, they can walk into their clinic and talk to their provider about a mental health concern, and they would have access to a psychiatrist, to a therapist, to a care manager, to a health advocate that can all work with the patient and their provider to come up with the best team possible.
I think that's so important because every time I go into an office, you do that checklist of mental health, and to be aware and to be talking about it, because I can't tell you how many stories we've done with heart patients or that or the other long-term issues where depression is definitely a factor in your progress or potential progress, right?
Yeah. You know, in a primary care setting, patients we feel so much more comfortable with our primary care provider who's known us for many years. It's a very safe, very convenient relationship that's not burdened by all the shame and stigma that you might experience in a behavioral health clinic. So to have that relationship with your provider and to be able to have that conversation with them and for the provider to be comfortable being able to say that, hey, I'm going to be able to introduce you to a therapist who's going to be able to help you with these symptoms of depression, or let me have you meet a psychiatrist who we have working for us. So it's really helpful for the providers to feel like they're better able to serve all of the healthcare needs of their patients too.
Thank you so much
My
for
pleasure.
letting us know about how important it is, and also telling us that there is access to this type of care right here in Utah.
Yes,
for
there is.
more information, you can go to intermountainhealthcare.org for all of that information. We'll have a link on our website, abc4.com. Glenn, to you.